I ngā mana, i ngā reo, i ngā karangatanga maha o te motu, tēnā koutou. Are you or anyone you know feeling a little bit worried about the COVID-19 vaccine? Well, you're not alone. He a wanga wanga nui. It's a really big decision. So I'm going to put some of the concerns to Dr Hinemoa Elder, child and adolescent psychiatrist, so that we can all feel comfortable about protecting ourselves, our whānau and our friends. Tēnā koe te tuakana, so many people feeling worried and concerned about their own decisions and decisions of their whānau. What's going on for people at the moment?
Kia ora. It's tough, isn't it? Because we're not used to having these kinds of conversations. We have no real experience of how to talk about vaccination, immunization in regard to this virus in the context of a global pandemic where more than 4.5 million people have already died. We've been largely protected here too, haven't we, from the worst of the virus until quite recently. So we've been watching the world coping from a distance. And I think that's also influenced some of our emotions, some of our trepidation about what's actually coming forward over the horizon for us.
Have you got any tips? I think we're learning by a mistake really that we can be polarizing instead of being helpful.
So we don't have to agree with everything our whānau think and say about COVID and about vaccination. But what we can do is we can say what we care about. So when you've listened and you've really heard and you've really paid attention to, actually I had some assumptions about what my whānau members might be thinking and why they were coming to the decision that they were coming to. But actually, I've heard some stuff that was different. So when you've heard all of that, you can say what you care about. And that might be, one of the things that's been real for me is I can't sleep worrying about if one of my whānau members got COVID, what would happen to our whānau. So just making a clear statement about what you care about is incredibly powerful.
How do we have the conversation about what the future might look like?
When we think about pneumonia, we think about TB, we think about other viruses, they are relatively stable. But this virus has been exceptional in its ability to adapt and evolve and to be super, what they call virulent, super nasty in terms of how it's affecting us and how it interferes with our body's immune system. So we have to keep in mind that there will be other variants and we can't predict how nasty they could be. So the best information we can go on at the moment is what we've got now. What are the suite of things? What are the range of things that we can do to keep ourselves and our whānau, all the people we love, well? And that includes masks, social distancing, the QR coding, all that contact tracing.
We're at the stage people are concerned and talking about long COVID, but we also have whānau that say, oh well, we had chickenpox and we survived. What's the difference here, Hinemoa, and what's your advice to them?
Viruses do change. That is inherent to their nature. They evolve. We know that the flu that we see each winter is different. That's why a different vaccine is offered for that. We've had to learn about the different face of COVID that we have now, which is Delta, and it's a much nastier illness. It's not the respiratory illness that we learned about back then. It's now a multi-organ inflammatory illness, and it's killing people much faster, and it's giving people much more nasty long-term side effects, like you mentioned, long COVID. So I don't know if people out there watching and listening have met people who've been in ICU, but I have been privileged to hear the stories, and it's a very, very unpleasant experience being in an ICU.
We're at the tipping point. That's what people say now. Do you think that?
I do think that. And I think one of the effects of this relatively long period that we've had observing the rest of the world has been that we are potentially more likely to have a sense of denial and avoidance around it being real, because we've been watching it from afar. So the reality of it is somewhat muted for us. But that reality is here now.
What we're hearing from people who are not vaccinated saying, well, actually, even double vaccinated people can have COVID and pass it on. Can you explain to our audience, why that's different?
So vaccination does not confer 100% guarantee of never getting that particular illness. But what it does do is it vastly reduces risk. And so that's super important. It's very important for our Māori and our Pacific nation peoples, because we are at a higher risk if we are exposed to the virus. So it looks like that the vaccination will reduce about 75% of that risk. And that's significant. And we know that if we can reduce the risk of getting the worst kind of symptoms, reduce the risk of dying from the illness, then that's an important consideration in our decision making.
There's a lot of talk around the perceived reaction to the vaccine. Then you've got people who say that they're immune compromised, that they also will self-isolate, and that they'll also use rongoa Māori or other wellness medicines. Can you speak to that?
Looking at the broader picture, it really worries me, because our rongoa was not designed for these kind of viruses. And talking with our kaumātua up home in Te Heku, I know, and in other parts of the country, they're all saying the same thing. And interestingly, our old people in Te Ao Māori, us, are getting vaccinated at really high rates, because there's an awareness that rongoa is a wonderful thing to use, but it's not going to give you the protection from coronavirus. So yes, we can do all of those things. We can self-isolate as much as possible. It's hard to live like that for long periods of time. Not great for your mental health. We do need to be connected to other people. So self-isolation is not a long-term strategy. You're going to meet the Delta variant. It's going to meet you somewhere in your life, in your daily life at some point soon. And so how are you going to set yourself up for success around that?
Some people are also concerned about how quickly the vaccine's been produced. Is it normal?
It did appear as if the vaccine sort of came out very quickly, and that was a worry for people. The technology has been around for 20 years. So these infectious diseases researchers are constantly scouring any information about new viruses coming up. They are anticipating that. And so when they heard the news about this virus in China at the end of 2019, they were immediately looking for ways to modify the vaccines they'd already developed to see if they could work for COVID-19.
Many Māori, as an example, say they just simply don't trust the system, and there's a lot of reasons why Māori shouldn't, and other groups of people shouldn't trust the system. What's your advice to our whānau who feel like this?
Look, I can really relate to this. I think as Māori, this is our lived experience. I am in a similar boat. I'm deeply skeptical, and I think this is a healthy mindset to critically appraise anything in Aotearoa. And at the same time, I hark back to our nanny's mum, who died in March 1919 at the time of the Great Flu, probably from the Great Flu, like about 2,500 of our tupuna did. And she had a 6-month-old baby back then and 7 other kids, including our nan. And I would love to go back in time and offer our tupuna a vaccine. They didn't have that option, but we do.
Well, tēnā koe te tuakana mō tēnei wānanga for this great discussion. It's been really helpful. Whānau, tēnā koe, I mihi ana te ngākau ki a koe, o tira ki a koutou katoa.
Kia ora, ngā mihi nui.